Hey everyone, welcome to Learn Now UG, a channel where we share medical information. You can like, share, and subscribe to it so that you don't miss out in case of any new information we update, usually in relation to Ugandan medical curriculum or clinical guidelines. So today we are looking at the Glasgow Coma scale, and it's a technique used to assess the level of consciousness of patients. Especially, we use it on those patients who have sustained head injuries. Therefore, this will help us to assess the severity of the patient. And when we assess the severity of the condition, we shall be able to give the appropriate medical intervention. Glasgow Coma scale involves 3 parameters, that is the eye response, the verbal response, and the motor response of the patient, usually abbreviated as EVM, and each carries 4, 5, and 6 scores respectively in that ascending order. Therefore, the total Glasgow Coma score is 15 and the lowest score is 3. Now let's start with the eye response. The eye response has the highest score of 4 and a lowest score of 1. Now, we award a score of 4 in case the patient is responsive and alert, therefore they open their eyes normally. Then we award a score of 3 in case someone is responsive to the speech. For example, if I say, "Hey Moses," and he opens the eyes, you award a score of 3. Then we award a score of 2 in case someone is only responsive to pain. When you inflict pain on them and they respond, we award 2. Then we award 1 mark in case someone is totally unresponsive, so they are unable to open their eyes. Now let's go to the verbal response. The verbal response has a total score of 5, the highest being 5 of course, and the lowest being 1 score. So we award 5 in case someone is oriented to person, time, and place they are in. So if in case the patient is able to identify the place they are in, correctly say the people they are with, and correctly say the place they are in, we award them a total of 5. Then we award 4 in case someone is confused. They don't know where they are, they don't know anything about them, they're just in a confused state. We give them 4. Then in case someone speaks inappropriate words, we give them a total of 3. For example, I show them a pen and they say it's a book, you give them a score of 3. Then in case someone speaks incomprehensible words, I mean incomprehensible, like words you don't understand, words which are not verbally correct, we give them a total of 2. Then we give 1 score in case someone is totally unresponsive verbally, they cannot say anything. Now let's move to the motor response. The motor response has a total of 6, and the highest being 6 and the lowest 1. So in case someone obeys commands, anything you tell them, lift up your hand, and they lift it up, you give them a total of 6. Then in case you inflict pain on his body and he moves to the localized pain, in case he's trying to touch the area in which you inflicted pain on, you give them a total of 5. Then we give a score of 4 in case they flex to withdraw from pain. For example, you inflict pain on them, they flex maybe their hand away from pain, we shall give them a total score of 4. Then we give a total score of 3 in case there is abnormal flexion. So in this scenario, we expect them, in case you inflicted pain, to flex away from pain. Instead, they flex towards pain. So that's an abnormal flexion. We give them a total of 3. Then we give a total score of 2 in case someone has abnormal extension. For example, I inflict pain, instead of extending away from pain, they extend towards pain. We give them a total of 2. Then we give a score of 1 in case the patient is totally unresponsive. They don't respond to anything. The motor activity is totally low. We give them 1. So after calculating this total Glasgow Coma scale, we present it in ranges, and these ranges help us to grade the level or the severity of the condition of this patient. So we have 3 to 8, that range 3 to 8, that is very severe. So these patients need really very critical medical intervention very fast and referral. Then in case they have a score of 9 to 12, that is moderate. And then in case they have a score of 13 to 15, that is mild. So they may not require very serious medical intervention. Then in case they have 15, that is the normal score. These patients are normal. That's what we had on Glasgow Coma Scale. You can subscribe and like us. Thank you. See you next time.